All right. Good morning, everyone. Welcome to another community conversation with Dan Noyes and Senator Richard Westman and myself. Thanks everyone for being here this morning. I know a number of folks who are here have been regulars, and we so appreciate you guys coming back. Some folks here for the first time. Thanks for joining us. Just a couple of things that I want to outline that I say every time. So I apologize for my repetition, but it feels important to say. Our hope really here is to create an open and safe space to connect and talk about some of the work we're doing in the legislature, but also just to connect with community members about what's on your mind. And oftentimes, ooh, hold on. I've got a little duplicate thing happening here. Sorry. So wanting to create an open and safe space for folks to talk about the things that they care about. And in order to do that, we just want to make sure that we all engage in a respectful manner with each other. And as I've said before, we have not had an issue with that to this point. It's been really a really great space to connect. And so we hope to continue that. Today, we're just going to go around quickly, and I'll just have Dan and Senator Westman introduce themselves. And then it's really an open forum. We have some other folks here who are engaged in the community, and anyone is welcome to raise their hand if they want to introduce themselves and the work that they're doing in the community. You're also welcome to use the chat in that way. And after Dan and Senator Westman introduce themselves, I'll explain a little bit about how to best get engaged in the conversation if you have questions or concerns that you want to voice. So on that note, Dan, you want to introduce yourself this morning?
Sure. Good morning. Dan Noyes, live in Wolcott. I know many of you there who's joining us today. So thanks for being here.
So
thanks. Yeah, Senator Westman, go for it.
I'm Rich Westman. There you go. Let's get to the question.
Get to the questions. We want maximum time for questions. We did also note that there is a lot of matching attire here today. Dan and I really connected with the gingham. We've got a whole Vermont flannel situation happening. So really feeling spring in Vermont right now. Yeah, so I'm Kate Donnally. I serve alongside Dan Noyes, serving Belvidere, Johnson, Hyde Park, and Wolcott. And yeah, we've had really good participation in the past few weeks, and so we do months, I guess, rather. And so we want to give as much time as possible for questions. And so if you got or feedback or comments, whatever you want to offer this morning. So the best way to do that, if you're able, is to raise your little virtual hand, and that can happen a couple different ways. For some folks, if you go into the participants section, you have a button at the bottom that says raise hand. For other folks, if you go into the reactions section, there's a little button there that says raise hand. You're also welcome to put a question or comment in the chat if you'd like us to respond that way and you don't feel like going on camera. Yeah, and I will pause there for a moment and let folks reflect on whether they have a question they want to ask or a comment they want to make. Great.
Yeah,
so
Kate, I'm sorry,
yeah.
This is Jack. Hi, Kate and Dan. I sent Westman. I was just mostly interested in keeping up with what y'all working on and what you think is really critical at this point. I mean, there's so much happening both nationally and statewide and locally, and this is a chance to keep up with you guys, which are more tuned in. I'd appreciate your input.
Yeah, absolutely. So why don't we just go around? Dan, do you want to start?
Kate? I'll start, sure. So this week, the that I've been working on for a number of years, the Office of the Child Advocate passed the House on a unanimous vote yesterday on Friday. And basically what this bill does is it creates a independent office within state government to really look at how youth in state custody are cared for. Our goal, obviously, is to make sure that these youth transition to adulthood successfully, and more input we can get as legislators about the systems and how they're working and how we can improve them and best practices, the better. So this is something that's been in the mix in the Human Services Committee for at least 10 years. And finally got it across the finish line yesterday afternoon. Well, in the House. Now it has to go to the Senate and then obviously onto the governor. So that's something that pretty exciting for me. I put a lot of work into it with Representative Redmond and Representative McFawn. The three of us worked quite a bit on it. So that was good to see. And otherwise, in my committee right now, we're really taking a deep dive into PFOA. And how they're regulated in our state or banned in some situations. Really a lot of chemistry, a lot of really trying to figure out what we can do. I probably got 100 emails a day on banning PFOA and firefighting for the National Guard and at the airport. And we can't. It's outside jurisdiction of it's all federal aviation and Army. So I think both are really interested in making sure that PFA is not something they use because it's a forever chemical and it's pretty poisonous. So I think that it's used a lot in packaging. If you go to McDonald's or your pizza boxes, they use PFOAs to make sure that the grease doesn't get through. It's in Teflon pans and stuff. It's not good. And it ends up in our rivers. It ends up in the environment because it leaches out of our landfills. So it's been used for years. And I think we're just figuring out it's probably not something we want in our state. So I'll just leave it at that. Looking forward to any questions.
Thanks, Dan. Not to put you on the spot, but I just saw a question pop up in the chat asking what PFOA stands for.
Let me look it up.
Any chemistry majors?
It's a class of chemicals. It's a class of chemicals. So it's like Teflon or Scotchgard had a lot of it in. And you also saw it with that St. Gobain company down in Bennington, where they got it in the drinking water down there. So I will get the exact chemical composition of that class of chemicals, but do you know it? It's
plural octanoic acid.
It's plural fluorocarbons.
Yeah.
And I didn't need to know that.
That's all right.
I just needed you to explain better what it was because I really didn't know when you were talking. So I'm all set with that.
Thank you, Aaron. We can get you the chemical compounds by email if you. Just kidding.
There's over 2,000 different chemical compounds in that class of chemicals, and we've only really tested about 6 of them, and it's not pretty. So.
Thanks. Senator Westman, you want to give us a little update on some of the stuff at the top of your list?
Why don't you go, Kate, and then I'll, because I've got 2 committees. You each are on one.
Yeah. So I guess when I think about sort of what's on my radar right now, there's sort of like 2 ways I think about it. The bulk of my time in the House is spent in committee, and so I think about some of the work that we're doing there. And thinking about, we've done a lot of work in the Judiciary Committee in the first half of the year. We passed out 11 bills, and so trying to also reflect on what it seems like the Senate is moving on. I think one of the big areas is continuing to fine tune law enforcement reform legislation. One of the things that's getting headlines is the way it's being framed is a relaxation of ban on chokeholds, and I understand why it's being framed in that way. Literally, I suppose it is a relaxation of that ban. I think essentially what's been happening with police reform is there was a big sweeping reform that was passed during the last session, and it moved very quickly because they had this sort of window where the public was really behind it and aware that this was something that needed to happen. And in the speed with which it moved, there was some negotiations essentially that went on with law enforcement, where law enforcement was saying, look, we get it, we're on board with this, but we need to be able to develop training manuals that align with what you're asking us to do, and we're concerned about some of the framing here. And so, part of moving rapidly during the last year was this agreement that we were going to come back to the table and kind of keep getting the language right so that we could develop a policy that, ensured the safety of our public and also honored the need for law enforcement to be able to train and to honor the lives of those who are engaging in law enforcement. And so with the chokehold ban situation, essentially, the way the original legislation was written, a law enforcement officer could not use a chokehold even in a situation where their life was at imminent risk. And part of the concern was that if you have banned any sort of physical intervention that a law enforcement officer could take if their life is at risk, that it only leaves their firearm as the only option to defend themselves. And so there was some discussion around how do we develop a policy that ensures that chokeholds are essentially illegal except in moments where you are at risk of death, and that we reduce the instances in those moments where a firearm would be used. And so just want to name that because I think it's framed a little differently in the press, and I'm happy to talk more about that another time. A big thing on our plate right now also is looking at this intersection between mental health and criminal justice. There's been a number of high-profile cases where people who have severe mental health issues have struggled to engage in either system, and people have been harmed as a result of that. And so we're trying to figure out legislative approaches that can help sort of strengthen that seam where the mental health system collides with the criminal justice system. And one of the pieces of legislation that's likely to pass out makes a couple of tweaks here and there, but really I think the bulk of it is going to create a task force that's looking exactly at this issue and forensic work around mental health, and how do we ensure that the Department of Mental Health has the resources and the systems they need in place in order to help, keep our community safe and defendants safe and victims of crime safe. So, and then, I have a feeling we'll talk more about pensions. Of course, that's at the top of the list, and bound up with pensions, I would say, and then I will stop talking. More globally outside of my committee, the top things on my mind have been pensions and the weighting study issues, which I'm not sure how familiar folks are with this issue of weighting studies. It's related to ed finance. So Vermont has a wildly complicated education finance system, and the ways that communities, and I'm probably going to botch this, but I'll just try to simplify it. The ways that communities are essentially given money to perform their educational duties is based in part on weights, and the weights are based in part on assessments of the needs of the youth that schools are working with. So if you have youth who have a higher level of need due to poverty, due to different, you might have communities that have higher rates of trauma or that are going to impact their learning needs. Theoretically, the weights should adjust for that, and those schools should receive more funding. It's been determined that the weights are far off the mark, and that in fact schools and communities that have a tremendous amount of need have been wildly underfunded for, I think, decades now. And the reason I feel this is bound up with pensions, and I swear I'm going to stop talking in a second, is because it impacts pay for teachers. It impacts funding for schools and municipalities. And so if we're talking about adjusting pensions and we're talking about pension reform and we're talking about, this is an equity issue that is also bound up in funding for schools. And so I feel like these things have to be thought of, not totally bound up together, but they're certainly linked. So there's a big push for waiting study reform at this time. And now I really will stop talking. And Senator Westman, if you want to chat a little bit about what's on your plate.
Oh, gosh. So my morning committee is natural resources. In the Senate, we're on 2 committees. My afternoon committee is appropriations. And let me start with natural resources. We've been dealing with a package from the governor and passed by the House to increase weatherization. There's $35 million in that. And the goal is to get to 120,000 homes over the next 10 years in weatherization. And we have the oldest housing stock in the country around that. In the ARPA funds that are coming from the federal government, there's roughly 200 million that the governor has laid out and talked about being used for climate related issues, with 100 million of that to be spent next year. There's a number of pieces around the climate piece, some including wastewater treatment plants. Most of our wastewater treatment plants for most of our larger communities were built in the 60s and 70s and are woefully inadequate now. And they are a big piece of the pollution going into the lake. And we're under the lake order from the FDA to get to certain standards over the next 10 to 15 years. So the federal money that has just come down in ARPA and the president's plan to have a big infrastructure bill, which they're talking about, could bring another couple of $2 billion to Vermont. Is we're trying to make sure that we're all up to date to be able to move in that direction. That's my morning committee. My afternoon committee, we will have the state budget out on Monday. I'm pretty happy to report that the bill that came over from the House has about $61 million in it to the state college system. That's up from a base funding of about 30 million. So it's about double that. They came into our committee and asked for another 23 million. I would suspect that in total package, we could end up around $80 million going for the transformation of the state college system. What that really means in essence is the state college system, regardless of where you, which campus you live on as a student, you would be able to take any class and it would be on in a setting where every major that is on every campus would be shared with the other ones, and you would have an electronic class. And there's a lot of downsizing to plant size. For example, at Johnson, McClellan's up for sale. State colleges are in there. We have all of the $1.3 billion in ARPA. That money is going through our committee. For me personally, because they break our committee up in appropriations into subject areas, my areas where I make the recommendations are the Department of Children and Families, DCF, Dale, and the Health Department. The three big issues that I'm dealing with are childcare, which we're changing the whole structure. We're in the third year of changing the structure of how we hand out money for subsidy kids. And I might say in childcare, it's very difficult because there's a push me, pull you between those people that want to have higher quality healthcare and the number of placements that we have. We have, we've been losing placement for kids in regulated care. We only have placements for about 45% of the kids that are born, and anybody that has a young family is desperate to find any childcare. So, so there's lots of issues in childcare. There's big issues in on the other end of the spectrum, adult days, which I'm struggling with. There were before the pandemic 14 adult days in the state, and our adult days the adult day in Barry, Rutland, and Newberry have all closed and decided not to open their doors, and which is a huge issue for anybody that is has an older parent that needs some help. And so we're dealing with that. We've got $5 million for the opening of the existing 11 to help them get off the ground, because as they open back up, most of them expect less than half of the kids, which particularly in a place like Morrisville where their adult day is, that's a huge issue. Also, we're dealing with the issue of the homeless issue and what we do as we transition through the homeless issue with the huge population. We have nearly 2,000 homeless people in motel rooms across the state. And as motel and hotels begin to open up, we don't have a place for a lot of them. And we're beginning to transfer, there's 200 million that the governor has set aside of the ARPA money to try to build permanent housing for these people. But the problem is they're buying up old motels to rehab them, some of which we already have people in those motel rooms for short term. So that's a few of the things I'm dealing with.
Thank you. I did see a question in the chat, and then I'll get to the hands that are raised. Senator Westman, do you have an answer for how will Vermonters qualify for the weatherization program, and how do they apply?
Oh, well, it depends on your income. If you're 80% of the median or below, it will be through a CAP agency, and they already have a program. So the Central Vermont Community Action Agency in Morrisville, you should go there if you're 80% of poverty. If you're above 80% of poverty, Efficiency Vermont is the place that you should call. And there is some problem with our program in that Efficiency Vermont really picks up for people above 120% of poverty. The community action agencies do people below 80%. So the people between 80% of the median and 120 are kind of someplace in the no man's land in between. But either the CAP agencies or Efficiency Vermont could direct you in the right place.
Thank you. All right, I'm just going to go in order of the hands I see. So Eric, I see your hand is raised.
Hi, thanks a lot. Thanks for doing this again, guys. So my question is, and I'll explain myself a little bit, is can labor unions, the teachers union, the Vermont State employees, count on your support on the pension issue? I mean, organized labor is a core constituency of the Democratic Party historically and in this state. And I've found it shocking that, the majority Democratic House has taken votes against organized labor twice. And, this, it feels like we've been taken for granted. And it's upsetting. Congratulations to Senator Westman and his colleagues in the Senate who instantly fixed the bill in ops about the pension task force to give equal representation to labor. But that bill came out of the House without equal representation was disappointing, and that it was so easily done in the Senate committee, I find is revealing. Also, can we count on your vote on the final composition of that task force to vote against one without equal representation for labor and for one with equal representation for labor? And also, I continue to be surprised that there's no leadership from the Democratic Party about finding other revenue sources for the pension problem. I've been reading these editorials about how it's courageous to try to solve this issue now. It is not courageous to fix this fiscal problem on the backs of middle-class public sector employees and the future retired Vermonters of this state. What would be courageous would be to stand up to wealth and power and demand that in this time of the pandemic, that we're all in this together and we all pay our fair share. That would be courageous. And the House leadership has led you guys astray by thinking you're getting cover by having everybody vote on this the same way. You're not. It's very much, the Vermont NEA, I don't know if you've heard of a guy named Tev Kelman, but he ran against Don Tinney for Vermont NEA president. And there's a feeling among the Vermont NEA membership that the Vermont NEA tends to be very moderate, right? And this guy, Tev Kelman, ran a more left, more activist, aggressive campaign on this. And he started his campaign with less than a month before the election. He got 45% of the vote, right? So that House Democrats and the Democratic leadership is not, acceding and getting behind the very moderate and reasonable demands of the Vermont NEA, I find is very stunning. And there's a very activist portion of the Vermont NEA that is really not going to put up with this. So my big question for you is, would you vote against next time you have the opportunity a pension task force that does not give equal representation to labor when this bill gets reconciled, hopefully the right way? And will you only vote for pension reform legislation that includes alternate revenue sources? Would you vote against one without significant revenue sources? Thank you for your time.
Thanks, Eric, and thanks for being here and for continuing to advocate on this issue. And I'll just say I really appreciate your method of advocacy, and truly appreciate being these are my words, not yours, but sort of called out and being asked to name specifics. And I will also just say that, in the time, just generally in my life, but certainly in the time that I'm in this role, I cannot, I won't ever be able to preemptively make promises about how I'm going to vote on any particular thing. There's so many intricacies that are involved in how a bill is put together. And so I wish, that in some ways, I wish I could just give you a blanket answer, and I can't, and I won't likely be able to on future issues. But, oh man, I hear you. This is such a difficult issue, and you have every right to be frustrated. I'm frustrated. This bill that we voted on, this is not, none of what I'm going to say is going to give you any kind of comfort or solace, but was really hard fought to get to that point, in the sense of strong internal resistance within the party that I was not going to vote on a bill that in its original form as it came through. I think slowing down was really hard fought. Getting a task force was really hard fought. And I I share your perspective that the sense is that the Senate has some work to do on this, and I look forward to whatever the Senate brings back to us. You know, I wish I had a more clear response. I have strongly advocated for looking at revenue sources, and that is now in a directive within the task force, which was really hard fought. You know, I might pause here. I look forward to seeing what the Senate does. I think the other thing that I was going to say, and you can absolutely push back on this, is there's a few factors involved. One is it makes sense to me that union representation and labor representation would be framed specifically as actual representatives from the actual unions. And I also think that we can look at this in terms of people at the table who might have unions back. I'm not sure, you aren't saying this, but I think some people have framed it as like the legislators. So currently, for those who don't know, the way that the task force is built, it would be 6 labor representatives from 3 different labor unions and 6 legislators, 3 from each chamber. And then there's a few representatives from the executive branch. And, you know, from internal conversations, there's a lot of, again, jockeying happening around, like, look, then it puts a lot of pressure on who those legislators would be around the table. And how do we make sure that the legislators that are at the table are people who are coming in good faith and who have the back of those who are within unions? Personally, I've been strongly advocating for it to be tripartisan. If there are 6 legislators that are representing, I am not sure that would happen. But again, I look forward to seeing what the Senate brings back. I think the other thing I'll say, and then I'll pass it on to others, is, and it's hard to say this, but it's true that the chunk of money that is being gobbled up by the pension issue and the general fund is so massive that this impacts Vermonters as a whole. And so, you know, I think it's trying to figure out how to
Can I make a comment on that, Kate? With regards to the massiveness of the amount, recently Vermont's bond rating by Fitch was upheld at AA+. And a quote from that is, "This approximately $96 million increase is not material concern in the context of the state's fiscal 2020 governmental funds expenditures of $6.2 billion. So that's really a talking point of the conservative right, that this is massive and unsustainable. Like, we definitely need to deal with it, and it can happen, but we don't need severe, instant, drastic cuts to solve this problem. It's well within the bond rating was upheld. And that was one thing that was worried about. Like, you know, I would really look to the leadership in the Progressive Party on this. Keisha Ram and Selena Coburn have come out behind labor in the way that we would expect our elected representatives to do. And you know, I think it's doable. You know, they've made a stand that I think is admirable, and I would look to them for leadership.
Yeah, and it's part of the reason that I've been advocating for tripartisan representation within the legislators that are on the committee. I will say that last I checked, the entire budget for the Department of Mental Health was $18 million. And we're talking about a lot of money here. So I'm going to pause there and let Dan and Senator Westman respond.
Thanks, Eric, for your question. It'll be, you know, in terms of what comes back from the Senate, we'll probably go to a committee of conference and not to a full House vote, but 125 people voted in favor of that. That last, you know, setup of this commission to really look at it. So it did have wide support. And I understand that you feel that labor was not, you know, represented equally. I thought it was, and you know, we'll look to see what happens and to see what they propose to the legislature for us to vote on next year. You know, it's definitely something that I believe we have to deal with, and I understand that, you know, I don't think we can kick the can down the road at this point much further, and I'll be interested to see what they propose. It's not going to be an easy vote, I'll tell you that.
Senator Westman, did you want to offer your thoughts?
So the piece I agree is that I don't think we can solve this by excluding the voices of the people doing the work, whether you're a state employee or you're a teacher. It will have to be worked out with their voices heard within the process around. I would somewhat disagree with you, Eric, in the respect that we have gone from about a little less than 5% of the total state budget as for retirement to nearly 14% now going to that. And that's in a 5-year period. So it really is an issue of what we can offer for other programs in the state. And particularly as we come out of this pandemic, we're not going to have the one-time monies that are coming down from the federal government. And we're facing a situation where even though we have the lowest unemployment rate in the country, we have less people working now than we did in 2019, which means there will be less tax dollars. So as we get out of that, the constraint on all of our revenues is going to be great in that. I personally think this idea of doing this all in a single package is not a great idea. There are lots of pieces to this. There are issues of revenue. There are issues of teachers are living longer. Teachers live 5.5 years longer than the average person in our society. Most teachers now live into their late 80s. That's very much like Social Security was a number of years ago. And Social Security went from 65 to 67.5. So there's all of these pieces, but I think we need to talk about them individually and put together a framework of where we need to go in the overall around this. But that can't be done without including the employees that are doing the work in that discussion.
Thanks. I'm gonna, if it's all right, I'm gonna move on because we have some other questions lined up. And as always, please continue to reach out about this. Let's keep talking about it. This is going to be an open process with whatever, assuming things move through and there is a task force created, it will now be an open, transparent process. And I'm happy to connect with folks in the off season, essentially, as it unfolds. Megan, I see your hand is raised.
Hey, I'm Megan Roy. I live in Wolcott, and I work for Lamoille County Mental Health Services. I'm a licensed clinical mental health counselor. So I'm right in there with mental health, Kate. I kind of know you through circles and your family through circles. And so I just wanted to get on records a little bit about what's going on in mental health and kind of leave it open. I know we don't have a lot of time. I have forever, since I've lived in Vermont, had to work 2 jobs to live here. So I do have a client at 10 and 11. So I kind of put things out and then I might have to go and eat a banana before I start. So I'll keep it kind of focused to the wait lists in Vermont. It's like a tidal wave. The wait list at Lamoille County Mental Health is about 50 in just children's, and we cannot hire therapists. Like, we cannot hire a therapist. We have 2.5 therapists. I'm only a half because I work full time, but I do intakes and assessments. And then I also see like a small caseload, but our other caseloads are full beyond full, including our case management caseloads. I mean, it's a lot on the mental health workers in Vermont right now. It's exhausting and it's discouraging. And yeah, I'm super tired. And I know everyone else is who works here too. Where are the therapists? That's what I want to know. I know NVU, which is where I went to grad school, and I went to undergrad at UVM with a bachelor's in social work. So I've lived in Vermont for 15 years now. I'm not from here. But yeah, I have so much student debt just from going to school in Vermont. And that's also, it's all wrapped into the same conversation, which is why I'm bringing it up. But where are the therapists? I think the hard thing is we have found therapists and we've offered them jobs, but our pay is so low in the DAs and the designated agencies that we cannot keep professionals. The very only reason I keep my job is for health insurance, which is horrible because I carry the health insurance for my family, but the pay is so low. I have to have 2 jobs to just get by. And so I think part of it is, where are the therapists? How can we recruit? How can we keep them on board and to serve the kids through DCF? I mean, Senator Westman was saying that's part of one of your committees that you serve as DCF. And I got a call last week from someone, a DCF worker in Newport. We don't serve Newport, of course, but he was calling because he was devastated by his wait list at Northeast Kingdom Mental Health. And so he was just desperately calling around for anyone to try to take kids, because he obviously sees the hardest and deals with the hardest of the hard, and he feels helpless. So he was reaching out to me. I had a conversation with him. He knows we couldn't take kids on, but we had a wait list of 50. Northeast Kingdom and their children's, he said that they have a wait list of 50 families just waiting. And then someone told me Washington County Mental Health, at least in their adult world, has a wait list of 100 people just wanting mental health and who cannot access mental health. Now, I do want to say, like, our crisis team is incredible, and all the DA crisis teams, they will get back to people, they will help people in hospitals. So the crisis piece, of course, they're overwhelmed, but at least we can get them like a bridge service so that they're not engaging in suicide. But that's the best we can do. Is to not have people kill themselves. And we can't even do that. I mean, we really can't even do that. So I think it's all wrapped into the conversation of, like, how do we get people wanting to be mental health workers in Vermont? How do we get young professionals like myself to stay in Vermont? Because it's exhausting just to live here and to try to be a professional and a young professional raising. I have a toddler. You know, my husband would want to be on this call right now. I think we'll have to trade off each month and start coming regularly, because it's been really interesting. Can I answer
sorry.
Yes, sorry, go ahead.
You've raised some really good points and things that I think about a lot. And in fact, I had some legislation that passed the House earlier this session that's now in Senate Health and Welfare, and that's H153. And what it does is it asks Department of Rate Setting to look at home and community-based providers and actually figure out what it costs to deliver these services, so that we can adequately compensate the employees, so that we don't have these huge gaps in being able to provide services to those in need. And I also feel that the Office of the Child Advocate, should that become law, can really look at the issues at DCF and come to the legislature and really say, okay, you have some serious problems within your mental health services, and here's best practices and how you should be budgeting to address these issues. So yeah, you're well heard. I mean, I think about, it's not only mental health, it's home health, it's all of our home and community-based providers are, Senator Westman spoke about the adult days, and, we have no idea what it costs to deliver these services. We have a general idea. I shouldn't say no idea, but, it's Medicaid reimbursement, and it's, 50 cents on the dollar or whatever it is. And, we're going to have to figure out how to how to deal with this. And the first step is really finding out what it costs to deliver these services. And so that's H-153. Call up your favorite senator who's on health and welfare and tell them they should think about that bill. Passed it last year too, so.
Just the last plug is that I feel like when issues of mental health dysfunction come up, it gets put back on the mental health agencies. And I want to make sure that that's said, that's not where it needs to go. It needs to go up because we just don't even have the funding to be covering. So yeah, so it's not like it gets put back on us to like change our practices and streamline this. And how can we do this? And we are efficient. Trust me. I see the efficiency every day and live it. So anyways, yeah, so making sure that the onus isn't put back on the workers and the mental health agencies itself. And thank you. This has been a really interesting conversation.
Yeah, Megan, thank you so much. And as you know, I'm a social worker and my life outside of the legislature, now I operate a private practice. And I really feel what you're talking about. And I think in terms of like, where are all the therapists? This is such a massively complex issue, obviously, but I think part of the way it unfolds in Vermont, in my experience, is that a lot of the therapists leave community mental health, as I did, and open private practices, as I did, if they are lucky enough to have the ability to access medical care and insurance outside of it. And one of the things that's really struck me is I think we can be doing such a better job of coordinating services between private practitioners and community mental health. And in my experience, because oftentimes, especially in these rural communities, many of the therapists that are being accessed are private practitioners, because the community mental health agencies have such a low capacity because of all the issues that you raised, like they aren't paid enough, blah, 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 blah. And yet, in my experience, I received like a year ago, and I'm sorry to blow up anyone's spot, but some letter from Vermont Care Partners that was basically like, hey, private practitioners, don't ever like access community mental health crisis services. Like, if you want to, you need to pay. Like, it was this whole like adversarial email that was like, basically, don't engage with each other. If you have people, you go over here, they have people, they go over here, you're supposed to be running your own practice. But my experience is like, part of my training is I work with really complex individuals, and I'm willing to hold that in the community in a private practice. And I think that's a service to the community mental health system that is so underfunded. And yet the message I get is, you don't have access to community mental health settings, which what that tells me is, okay, I'm not going to work with more complex clients because I can't trust that I can access this. It should be an interwoven system, especially in these rural communities where so many people are in private practice. And so I think that's one of the areas that we can look at is how are we currently supporting engagement between therapists that are in the community and therapists that are in community mental health, and ensure that we're creating an interconnected system here as opposed to a adversarial system, which I think is probably not intentionally what is currently happening.
That's the first time I've heard that as well, just to let you know, because that blows my mind, because that means all of the highly traumatized, complicated, complex cases come to the mental health agency, which is why all of our therapists we burn out because we hold such crazy complicated cases. And I think you're right. There needs to be more discussion around that. Thank you.
So I would say over the last 5 years, if you go back to when Savi was the head of, it was really clear to us, there was a 26% turnover in mental health agency workers across the board. The Senate took on 4 years ago, and I think we ended in last year's giving rate increases to get the base wage up in at the mental health agencies to $15. And I have to say that Tim Ash, as president pro tem of the Senate, he took that on to do that. It's not a big step, but at least we still have a turnover rate of around 20%, but it is down from 26. So there are people that have been listening and trying to do something about this in that. And that said, part of our problem, it goes back to the demographic problem. There isn't the people going in to be educated in the field. People aren't going in the numbers to be able to take care of the people that we need to. But and so we have all sorts of loan repayment, all sorts of stuff to try to do that. But that fits in with, we have a crisis in nurses. We have a crisis in primary care doctors going in. We can't get enough people to go to work in childcare now. It's across the board, and some of it is totally the funding, but some of it now is coming in up in the pipeline. We don't have the people that are doing it, and it's causing it's terrible across the board. The people going to work in childcare is we don't have enough. So.
Thank you. So I know it's 9:55, and William and David, you've had your hands up this whole time, and so I'm happy to stick around and make sure that your questions or comments are heard and answered. Folks, feel free to jump off at 10 if you have places you need to be, but I just wanted to name that. You guys have been patient as we've worked through these questions. So with that said, William, I see your hand is up.
Yeah, how you doing? Thank you. Yeah, just keying in on the pension issue. There is, I don't know of too many public sector pension systems that are fully funded, and obviously management could be much better. However, I think one of the things that you could do to perhaps help the issue is to stop recruiting younger employees into the pension system and give them the option of a defined contribution plan. So they're much less expensive to administer, and obviously it would give more control to the individual as far as their future for retirement. So just my 2 cents there. Thank you.
Thank you. Yes, thanks for offering those. And I think you're hitting on something that's come up in the pension discussion, which is, that there are different perspectives and needs within public employees. And, we have heard from some younger teachers and state employees who have advocated that this be an option that is looked at. And I think that's in part why in the task force language that was moved through the House, and this is a point of contention for some folks, but it was explicitly said, like, let's look at what it would mean to pursue a defined contribution option. I think there's a lot of evidence to suggest that long-term outcomes are better with a defined benefit plan. Some even say that might be a contributing factor to why teachers live longer lives. But it is something that's being looked at in the upcoming task force if it were to move through in the way that it's currently structured in the House. So I think you're not alone in those thoughts. Thanks. David, you had your hand up.
Yes, I'm not sure if I'm on or not.
You are. Hello.
Can you hear me?
We can.
Yes.
Okay, great. My issue is ATVs and their ability to be able to turn Vermont basically into terrain park for themselves. I don't know what the laws are pertaining to class 4 roads, but it seems that they have unfettered access to whatever class 4 road they want to run on. And the people that are paying property taxes on that land really have no legal way to prevent them from doing so. And I mean, it truly diminishes the quality of life for folks that live on back roads in Vermont, because if there's a class 4 road that merges into a class 3, then some town select boards are allowing them to use the public roads for their own personal use. I mean, they're not registered. They're not, I don't know if they're registered, insured, if people have to be licensed. It's a public safety issue, not to mention the fact the cops can't enforce any laws because all they have to do is zip down to the end of a class 3 road, get on a class 4, and they're gone. There's no accountability in that respect. And it's just, I mean, the governor's trying to incentivize folks to move to this state, young families. And if they buy a house, if they bought one today, not knowing there's a class 4 road at the end of their class 3 road, I mean, it seems like we're bringing broadband from the main road to the last mile of a dirt road, but then you have a collision with ATVers coming off the class 4 road into the class 3 road. And I mean, last summer I was working on a friend's house. I had to prep it and paint it or stain it. And I was there for a couple months. And on the weekend, there would be packs of ATVs. I mean, 15 at a time going up and down the road. She set up a game camera, and one day she counted 70 of them. I mean, that's just absurd. I'm sorry. That's all I have to say about that for now. Thank you.
Thank you. Senator Westman or Dan, do you have a response for that? I feel like you have been more up on this.
I believe that ATV use on class 4 roads or class 3 roads is regulated by the municipality. I think that is something the select board talks about, and they set ordinances around ATV use. I don't know of any legislation around having the state regulate where ATVs could be used on class 4 roads. You know, I know there's definitely some concern about erosion and being in compliance with the back roads requirements, but I think a lot of that winds up with the municipality. They're the ones who are in charge of the roads, the select board.
Yeah, I would say if you travel off from your own property, it has to be registered. So number one, if they're going without a sticker, they're illegal. You know, the whole issue of ATVs is quite a hot one with a lot of people in the discussions back and forth. And what they settled on was that local select boards would have control of what could happen on a town road, because of course, if you're in the Northeast Kingdom in a very small community, or it's very different than in Morrisville. And so the compromise in that was to leave it in front of select boards. The biggest controversy for the state has been what happens on anything that is public lands. And thus far, our state has decided that use of ATVs on public lands is pretty much prohibited. But that's where the legislature has had most of their discussions, is around what happens on public lands.
Okay.
Thank you. Thanks for bringing that up. All right, everyone. Sorry. Go ahead, Dan.
Thing. I mean, if you're having ATVs, you know, that are, it says my connection is unstable, so I hope you can hear me. You know, you should reach out to the group, the Vermont Sportsmen's, the VASA group, you know, and talk to them, or talk to the sheriff's department or whatever. I don't, I think, you know, if they're whipping up and down the road, I think there's speed limits and stuff so I just throw that out there.
Thank you.
All right. Thanks everyone for being here this morning. Another lovely chat. You should have my contact information. Feel free to reach out anytime. We're always happy to answer any questions that come up. And we will have one more of these Zoom-based community meetings in the last fourth Saturday of May. And then we're going to sort of put our heads together and think about what it looks like during the off season, essentially. But I know that we are likely to be out at Tuesday Night Live, which they just announced is going to be happening this summer, and some of these other public spaces. So I know Dan is beside himself. He'd be happy as Zoom.
I'm thrilled.